So we got really interested in the idea of changes in body schema and body image, or kind of the representational health of the body parts after an injury. And a colleague of mine works with women post-breast cancer and breast cancer survivors. She's done a number of studies, and we started talking about whether this could be something that is involved or impacted by survivorship after the treatments for the breast cancer. In fact, some women were even expressing a bit of dissatisfaction or even a sense of betrayal. So it was that language that started us down this road of thinking about what might have changed that we can look at from clinical measures in terms of body image and that body schema, if you will, for the representational health in their brains. In the studies that have looked at acute pain, it's quite interesting that the side where the pain is happening, where it's experimentally induced, there's no change in accuracy or reaction time on that side. It's actually the unaffected side, the side that doesn't have the induced pain, where there's a delay. And what that would suggest is that, and what's been hypothesized is that there's a bias towards this new pain. There's this bias towards this acute pain that we're kind of inhibiting any information about the other side. Which would immediate stage for this data set we have is we have to get out what is normal for even doing this left-right discrimination task for this new area of the body that hasn't been tested before. So that's be a foundation to be able to say, okay, if somebody were to test this in an individual, how does it stack up? Does it look like there's any impairment that we could then design something to treat that? I think that's step one, as well as then immediately following that, well, what did we get from this study in this big cohort of women post-breast cancer treatment? I think that's all great to try to figure out what's happening, but really our ultimate goal is to understand that better so that we can make some suggestions for treatment, test out in some clinical trials, to really help refine the decision-making process of, well, what do we do about it? Because it's great to know a little bit more of what might be happening in these links between the peripheral and the central changes that are often driven by that experience. But ultimately, it's about how can we help?